Hi, thanks, Jetra. Good evening, everyone. I hope everyone has had their dinner and can give me some of your time to actually listen to what we're going to talk about. Okay, my name is Kelvin. I'm a physiotherapist from EMW Physiotherapy and TCM. We are a fairly new entity, but I've been in practice for the past 17 years, but we just started this practice in January because we want to marry both East and West together and give the best care to both to give the best care to all our patients, marrying the East and West approach. Okay, so I'm actually going to start my presentation now. I'm going to share my screen. Okay, so the topic we're going to talk about is actually pain in the neck and how do we manage it. If you can see from this statistics, actually 2/3 of all our population will have neck pain. And the causes of back pain varies from poor posture to road traffic accidents to sleeping on a wrong pillow, as what Chinese like to say, 绕枕, or in the Malay terms, they always say salah bantal, so using wrong pillows, that kind of stuff. The severity of the neck pain varies from just a mild ache, mild disturbance to your life to as severe as paralysis. So when it comes to neck pain, most of our patients would generally come to us pretty quick as compared to low back pain, because low back pain people can bear the pain a bit longer, but when it comes to neck pain, when they start getting numbness in their hands or whatsoever, they tend to come in pretty quickly. And if you can see here, actually 5% of our population actually suffers from permanent disabilities. And when we talk about permanent disabilities, we're talking about losing the control of their arm, permanent numbness in their hands, or in really very worst case scenarios, they sometimes get paralysis from neck down or shoulder down. Okay, but these are very rare occasions. So as what I was saying just now, common causes is sometimes sleeping, wrong posture. Worse still, sometimes now all of us are working from home. We are working longer hours. Sometimes we tend to fall asleep at our desk. Stress is actually another big cause of neck pain. And that center picture of the elderly lady with the granddaughter, all of us will grow old, and neck pain is something that happens to all of us. In a matter of fact, the disc in our neck starts degenerating after 20 years old. So can you imagine, with the average lifespan of Singaporeans now hitting about late 70s to early 80s, our neck will take about 40, 50 years to degenerate. But because nowadays with all the mobile devices that we are on, maybe the mobile phones, maybe tablets, maybe laptops, our degeneration will get worse. Okay, in my 17 years as a physiotherapist, I have seen how we have shifted in terms of the age range of patients who come in for neck pain. In my early part of my career, I would say maybe I used to see patients in their 40s, 50s, and maybe 60s who coming in with neck pain, with arm numbness, that kind of stuff. But well, we do now see much younger patients. My youngest patient with a neck problem, surprisingly, is a 14-year-old girl who spends most of the time working behind the laptop. But is it the laptop that's to be blamed? No, I guess it's mainly the posture, because nowadays, kids, and especially now, everyone during the circuit breaker period, they were home-based learning, that kind of stuff. If you have a proper table, that's good, but most of the time, kids will be kids. They put their laptops on the bed, lie on their tummy, do their work, and that's how degeneration, or that's how they can actually cause themselves more neck pains, that kind of stuff. So these are the more common types of neck pains that we actually see. The normal neck ache, so you can wake up in the morning and you find that, oh, my neck, I can't turn to one side, that is wry neck, okay? Or Chinese call it 绕枕, or in the Malay way, I'm a Peranakan, so I will go Malay, they'll go salah bantal. So it's either the pillow is too high or too low or whatsoever, or predominantly wry neck happens when we sleep in one position throughout the night without actually turning or without actually moving. Degeneration, as I said, happens to all of us. After we turn 20, our disc in our neck starts to degenerate. We don't watch our posture, it gets worse. Whiplash, nowadays we can be safe drivers, okay? But sometimes people can get distracted on their phones when they're driving. They don't pay attention, they meet a car accident, either you bang someone or someone bangs you, your neck is being thrown forcefully forward and backwards, and that's how you sustain a whiplash. Slip disc in the neck, not a very common thing without trauma. So there are patients who have slip disc in the neck after doing bench press, lifting something heavy, or sometimes actually a result of a whiplash. And radiculopathy is actually a very big term. It just means that there's pain or numbness going down your arm that's originating from your neck. Okay. So if you can see here, there's this three very common sitting postures that most of us adopt. Okay. In years gone by, we used to say, look, you need to sit in the right posture. So what is right? I guess most of us will know number one is wrong. So then you're leaning towards number 2 or number 3. Okay. Theoretically, you should be sitting all the way back in, having a backrest to support your back. So some people say 3 is right. Some people say 2 is right. Well, 3 is wrong, 2 is right. Okay. But with now we are working from home a lot, honestly speaking, all 3 postures are not wrong. Okay. And what do I mean by all 3 postures are not wrong? The key is you want to avoid staying in one posture for too long. As they always say, too much of a good thing may not necessarily be good. Of course, too much of a bad thing is naturally bad. So if you're sitting like in picture 3, and if you're doing that for maybe 5-10 minutes, that's perfectly fine. If you could sit like in picture 1, whereby you just go all the way down, that sometimes your body is telling you, hey, I'm tired, let's change your posture. So posture number 2 is what I would recommend to most of my patients when they start off every hour behind the computer. So try to sit up straight, open up your shoulders, tuck your chin gently in, keep your ears over your shoulder, shoulder over your hips. So keep that neutral position. Whereas in posture 3, that is actually not really right because you're actually arching your back pretty much backwards and the chin still pokes forward. Okay. So now that everyone's actually working from home, some people were actually, as I think if you all remembered, just before circuit breaker, there was a long queue of people waiting to go into IKEA, wanting to buy tables, wanting to buy chairs. Sometimes they say, oh, I'm buying tables for my kid to study at home, study from home, and I need a proper chair, that kind of stuff. So a lot of times people ask, what should be our sitting posture like? What's our office ergonomics should be? Okay, so in this picture, it's a very simple illustration. I will actually send this slide over to the organizer. So if you want to, they can actually share this slide with you guys and send it to you all via email so that you can have a guide of this. The 2 most important things I will always point out to everyone is the angle of your elbow. Okay, your angle of the elbow should be no more than 90 degrees. Okay, and the angle of your knee too, so that where your foot placement should be flat on the ground and the knee should be at 90-degree angle. But lo and behold, most of the furnitures are designed not for Asians, in a matter of fact. Most of the furnitures that we have follows the 40th to the 65th percentile of data collected. Okay, anthropometric data, which is all how was the average height of people, that kind of stuff, but these were collected with the Caucasian population. So unless we are of Caucasian sizes, most of our furnitures are actually not designed for us. So if our feet can't touch the ground to maintain a 90-degree angle when we sit, what can we do? A footstool. If you can see in this picture, there's actually a footrest. So put a footrest there. That should help to keep the knees at a 90-degree angle. And always try to bring the chair as close to the table as possible, Okay, and that's why some people nowadays, they take away if you remember, we used to have a keyboard drawer, and now the keyboard drawers have all been removed because nowadays everyone is using a laptop. There's no need for keyboard drawers, and the keyboard drawers actually don't allow us to sit all the way close to the computer. Okay, and the angle, okay, laptops, the screen angle can be adjusted. So please adjust the screen, tilt it as far back as you can so that you do not end up having to strain your neck and poke your chin forward and look at the screen. You want to keep the chin gently tucked in, tilt the screen upwards a little bit so that you actually look in a slight downward angle. The height of the chair should be the height of from the knee to your feet. And if you can't, as I said, if you can't maintain a 90-degree angle for your feet to stay on the ground, put a footrest there. So the next slide, we're going to look at how we organize the table. Okay, if you can see that range, the red checkered areas are what I call as the OB zone, out of bounds zone. Okay, and what do we mean by this OB zone? So a very simple rule of thumb is the radius of your forearm, and forearm, what do we mean by forearm, is from your elbow to your tip of your fingers. That is your forearm. Anything that you use regularly, and when I say regularly, I'm talking maybe every few minutes you're using it, they should be at the range and reach of your forearm. So like your keyboard, your mouse, they should be at the range of your forearm. Okay? Anything that you use maybe 3-4 times in an hour is the reach of your arm. So from your shoulder to your fingertips, this range is the range that you should be putting things that you use maybe 2 to 3 times in an hour, maybe a notepad, your pen, your phone, maybe a cup of water. That is what it should be. And any other things, put it away. Reason for that, the more cluttered your table is, the more likely you are to slouch. The more cluttered your table, the more likely you have a lesser working space, you feel very cramped, you're going to tighten yourself up, your posture is not going to be good. Okay, so when you clear the clutter on the table and things that you use maybe once or twice every hour you store away, that encourages you to leave your desk. Okay, so that when you come back and you reset yourself in the right posture again. Okay, so this is another example of how you position yourself. Okay, a lot of people nowadays ask, I never used to have a neck pain when I'm working in the office. Why am I having more aches and pains now that I'm working from home? The biggest reason is not because your office, your setup of your workstation is not good. Some of you actually brought back your computer screens at home. You start buying new gadgets, that kind of stuff. It's not about that. The reason why you're getting more neck pain nowadays when you're working from home is because we don't realize that we are actually working longer hours behind the computer. What used to be like when you're working in the office, what used to be a simple water break, getting a glass of water or making yourself a cup of coffee, was maybe a 10-minute activity, which we don't realize it was 10 minutes because you go and grab your mug, go to the sink, wash your mug, put your coffee powder, put your hot water, stir it, and hey, I meet a colleague and I'm standing there, I'm having a little chat with my colleague. 5 minutes gone by, I go back to my workstation, I start my work. Going to the toilet, maybe a 15-minute time frame. So these small little things have taken us away from the desk, okay? But when we are back at home, a water run is 2 minutes. If you've got a helper, worse still, you never leave your desk at all. You tell your helper, can I have a glass of water? Your helper brings you a glass of water. Going to the toilet, most of our houses, unless you're living in a terrace house or a landed property, even that, your toilets are all nearby. Your toilets are maybe less than 10 meters walk away. Whereas if you're working in the office, the toilets most probably is a 10, 15, 20 meter walk, which will take you maybe 5 minutes to the toilet, 5 minutes back, in between again, same thing, meet a colleague, chit chat, or bump into a colleague and you want to discuss something, you leave your desk. But when we are working from home, we don't leave our desk much at all. So we are sitting down behind the desk for long durations of time, and that is what's causing us to have poor posture and giving us neck pain. Okay, so how then do we relieve our neck pain? Okay, I'm just going to share with you guys two very simple stretches. Okay, and this stretch, I would say, I'm going to show you two stretches and you can alternate them. Do it every other hour and hold each stretch for 15 seconds and for 4 repetitions. Some of my patients tell me, Kelvin, that takes a lot of time out of me. 4 repetitions, 15 seconds, that is 1 minute per side, which is 2 minutes that I've got to take myself out of my work. I'm like, yes, but it's just 2 minutes will give you a relief in your pain. Okay, so it's two very simple stretches that can help you to relieve your pain. If you can see on the top left, my model is showing looking to one side, looking downwards, and hand at the back of the head, giving herself a nice pull. You will feel the stretch at the back of the neck. Okay, this is a stretch for your levator scap muscle. Okay, patients sometimes can't remember what's the position. To make it simple, I tell my patients, smell your armpit. So look to your left, look downwards, smell the armpit, give it a gentle pull. Hold that for 15 seconds. And then as you relax, release it gently, turn to the other side, look downwards, gentle pull. And it should not be a tug, that kind of stuff. It's a gentle pull. You should just feel a mild, gentle stretch at this part of your neck. It should not be painful. And if whatever range you have, maybe if you're just doing this and you feel a stretch, so be it. Gentle pull, 15 seconds. If you can go a little bit more, good. If you can't, within your tolerance. It should be a pulling sensation and it should not be painful. Okay. The bottom right is just purely a side stretch, pulling downwards. Okay. This is more stretching what we call the upper traps muscle. Okay. This is purely more on the side here. Same thing, 15 seconds. Change sides. Gentle, 15 seconds. The word here is 15 seconds and not 15 counts. Okay, because most of us, when we do our stretches, we go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. If you have actually timed me in when I count 1 to 15, it's as max 7 seconds. Okay, 7 seconds of stretch is not sufficient. In those days, for us guys who have served national service, we hold the stretch 10 counts and we just do 2 repetitions of it. Sorry, study shows that doesn't work. You minimally need to hold the stretch at least 3 repetitions, 15 seconds hold. Okay, so that's why the stretch here is 15 seconds, at least 4 repetitions. If you find that counting 15 seconds is a little bit too long, count to 30. Count to 30 takes us maybe 15, 18 seconds to count to 30, and that is good enough. Okay? So, all I would always say is a stretch every hour keeps the pain away, and I would also say a stretch every hour keeps you away from us. Okay? Pain is not something that we want to live with. Can we live without pain? Yes, we can. All we need to do is make sure we focus, watch our posture, and keep the pain away. So I'm going to bring up this slide again in terms of the posture. Is posture number 1 bad? No. Is posture number 3 bad? No. But it's only bad if you stay in that position for too long. Okay? And that is also why when we were in school, each lesson was actually kept at about half an hour or maximum an hour, because we want to vary our postures. But as we grow older, we went to polytechnic, we went to university, lessons, even lectures were like 1 hour, maximum 2, but because we were walking around, that helps us to change our posture. So vary your posture. Okay, so if I can leave you guys with one last message, besides a stretch every hour keeps the pain away, the key is vary your posture. Do not stay in one position for too long. Even the best posture for too long is not good. Okay, so I'm going to end my talk here. Thank you so much for your kind attention. Okay, I'll hand the mic back to Jetra, and I will take your questions at the end of her presentation. Jetra, back to you.